Bonjour à tous. From day one, our government has been working with the provinces and territories to keep Canadians safe and address this pandemic. And this morning, I want to begin with an update on where this work stands. Yesterday, the Premiers and I, along with Deputy Prime Minister Freeland, had our 11th First Ministers meeting since this crisis began. We discussed the very concerning reports regarding certain long-term care homes in Ontario and Quebec. What the Canadian Armed Forces reported is deeply disturbing. That any senior would face this kind of treatment is unacceptable. And as I said to the Premiers, our government will be there to support them as we work together to ensure that our elders receive the care they deserve. In our meeting, we also talked about what we need to do together to help businesses reopen and get people back on the job while keeping our communities safe. Moving forward, it will become even more important to quickly identify and then isolate this virus. To do that effectively, we need to coordinate across the country. A number of provinces have already reached out to us for support on contact tracing, and our governments are currently working together on a data sharing platform. And yesterday, First Ministers were briefed on the work being done by the COVID-19 Immunity Task Force, which will coordinate blood test surveys across Canada. The Premiers and I also spoke about support for workers during this difficult time. Our government will continue discussions with the provinces on ensuring that as we enter the recovery phase, every worker in Canada has 10 days of paid sick leave a year, because no one should have to choose between taking a day off sick and paying their bills. Hier, les premiers ministres, la vice-première ministre Freeland
Yesterday, the premiers and Minister Freeland and myself have been looking at the very preoccupying reports we received regarding long-term care homes in Ontario and Quebec. We should do more for our seniors. And the governor, as I said, the government will be here to help them, support them, and give our seniors the care they deserve. And we also tackled the manner in which we might work together for the purpose of detecting quickly the virus and isolate it. And the Premiers received an update regarding the work of the task force regarding the COVID-19 coordinating group for blood tests in the country. We also discussed the way we might support workers during these difficult times, and our government is still holding discussions with the provinces in order for us, when recovery starts, each worker had 10 days of paid sick leave per year, and will be working with the leaders of First Nations, Inuit and the Metis Nation for the purpose of supporting their communities during the crisis. We have invested in all kinds of areas for Indigenous communities or companies, help to students and people living outside the reserves. But we have more to do, and today we are moving to another step.
Investing $650 million to support Indigenous communities on health care, income support, and new shelters for women. Let me start with the first pillar, which is health care. Although we've made progress, there are still communities that are not properly equipped to handle a COVID-19 outbreak, and we need to address that. That's why we're investing over $285 million for public health in First Nations, Inuit and Metis communities. These funds will go toward more nurses, will help procure specialized supplies, and will support work with First Nations, Inuit and Metis communities on continued community-driven responses. Having the right health care is essential, but it isn't the only concern facing communities right now. Because of this pandemic, a lot of people also need a hand in paying for the basics. So, as a second pillar of this investment, we are boosting the On-Reserve Income Assistance Program. This money will support people living on reserve who need help paying for things like groceries, cleaning supplies, or rent. A portion of this funding will also help First Nations communities continue to provide services like skills training and support for people as they navigate federal benefits. The work being done in communities by members of the communities is incredibly important to help people get through this very challenging time. And that brings me to the third pillar of this funding, investment in shelters. In April, we announced $10 million so that emergency shelters for Indigenous women and children could adapt to the new challenges posed by COVID-19. This is vital support in the short term. But in the long term, more still needs to be done. So today I can announce that our government is investing an additional $85 million for new shelters for Indigenous women. These shelters will be built in communities across the country, including in the north. No one should have a place to stay when they're unsafe. No one should have a place to stay. No one should have to stay in a place where they're unsafe. No one should be forced to choose between violence or homelessness. These new shelters will offer a path forward when people need it most. Ce matin, j'annonce un nouvel
This
investissement.
morning, I'm announcing a new investment of $650 million in order to help Indigenous communities through this crisis, and we are investing $285 million in health care and in order to increase the number of nurses working for First Nations and to buy also specialized equipment. And these funds will be used also to help the work which we are carrying out with the First Nations, Inuit and Metis communities in order to focus our action on healthcare in those communities. And we will be increasing the income support program to help them with their daily expenditures. And part of this funding will be helping these First Nations community to receive important services. And we'll be finally investing $85 million in new shelter homes for Indigenous women, and these new shelters, which will be located within the communities, will offer those women a secure place and resources as they need it most.
Today with an update on another measure we've taken to keep Canadians safe. Earlier this morning, Minister Garneau announced that large cruise ships will not be allowed in Canadian waters until at least October 31st. This decision extends the one we made in March, which was taken to protect our coastal communities. COVID-19 is still a very serious threat, but with the right plan and with the right investments, we will weather this storm together. Merci.
Thank you, Prime Minister. We'll now go to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. First question, Kate Balangaro, Bloomberg. Line open.
Hi, Prime Minister. I have a question about the Finance Ministry has updated the cost estimates for CERB and the wage subsidy that shows companies aren't using CEWS as much as you'd hope. And it seems that they're happy that the government is footing the bill for these programs. Is this smaller take-up of the wage subsidy a concern for you and the attitude you're seeing from businesses?
I think it demonstrates how hard this pandemic hit our economy and how many people actually found themselves without a paycheck, which is why we were glad we have the CERB to be able to support millions of Canadians who need help paying for groceries, paying their rent. But as we move forward and as businesses start to reopen and need to get people back to work, the Canada Emergency Wage Subsidy will become more and more important, which is why we extended it throughout the summer, and will continue to encourage employers to rehire employees to be able to get our economy going once again. Okay.
We have recognized that the situation is extremely serious, and this is why we want to provide direct assistance to the CERB to millions of Canadians who lost their paycheck. However, as we reopen the economy and as we restart work through our businesses, we need for those businesses to rehire the former employees and new employees, and this wage subsidy will help them do so and do what's necessary for the purpose of restarting our economy.
So while China has remained quite vocal and firm in pursuing its more aggressive foreign policy, including towards Canada with the Meng case that we saw continuing on Wednesday, and Canada has been rather avoidant in using strong words against China. I'm wondering how much more aggression from Beijing will it take for you to stand up to Xi Jinping, and are you afraid of him?
We have continued to put Canadian interests and Canadian principles at the forefront of everything we do around the world, including with China. We will continue to work to ensure that Canadians have the equipment that we need to get through this situation, while at the same time expressing our concern for the 2 Canadians arbitrarily detained in China, and continue to highlight our concerns around Hong Kong and around questions that need to be asked for the WHO. We will continue to stand up for our principles and continue to look out for the interests of all Canadians. We shall continue
to emphasize our concerns regarding China, about Hong Kong, about Canadians who are detained, and also the WHO, all the while guaranteeing Canadians that they can receive the equipment that we need from countries throughout the world, including China. So we will always put first the interests of Canadians, because this is what they expect of us.
Thank you. Merci. Prochaine question, Michel Lamarche, TVA. À vous.
Mr. Trudeau, this morning we heard Mr. Garneau, who was kind of alluding to the fact that if we want to keep airlines healthy financially, we should forego the reimbursement of airplane tickets which have been paid already. Obviously, my first concern goes to Canadians, people who need to manage through the crisis and come out of it and have enough money in their pockets. This is why we put money in the pockets of Canadians. So we work with airlines, we work together with all Canadians in order to find a way that will enable us to help Canadians, all the while making sure that we keep a healthy airline industry once the crisis is over. It is quite a difficult challenge, but we do know and understand Canadians' preoccupations in this bit.
This pandemic has been on Canadians, on getting them the support they need, which is why we put out millions, billions of dollars in support for Canadians to help them get through this. I hear clearly the concerns that Canadians have around their air tickets. We will continue to work with the industry and with concerned groups of Canadians to ensure that we find a fair way through this. But I know Canadians at the same time want to make sure we continue to have an airline industry after this very difficult pandemic. Getting that balance right and listening to Canadians is what we will do.
Suivi, Michel?
Yes, let me repeat. Do you think that the survival of the airline industry is threatened? And I'd like to hear you about the long-term care homes. So because don't you think that you should also adopt national or pan-Canadian directives? Well, while we were discussing the situation with premiers last night, we wanted to make sure that all Canadians should receive high standard and quality care in those homes in particular. This is why we want to help the provinces to come to a renewed control of the situation. And at the same time, we were looking more to the long term for the purpose of helping our seniors in order to provide them with all the care they deserve.
We talked about last night was the importance of ensuring that in the short term we are giving to our seniors all the support they could possibly need through this very difficult pandemic. But we all very much agree that as we move forward, we need to make sure that all of our seniors everywhere across the country get the top quality service and care they deserve. And the federal government will happily be a part of those discussions as provinces lean in on this issue.
Merci. Prochaine question, operator.
Thank you. Merci. Prochaine question. Mélanie
Next
Marquis,
question.
La Presse. À vous.
Mélanie Marquis, La Presse. Good morning, Mr. Trudeau. Back to the question asked by my colleague Michel. You haven't answered the question regarding the refunds of airline tickets for flights which have been cancelled. You say that you want to put money into Canadians' pockets. Should we understand that for you, airline tickets that Canadians have already purchased are luxury items which do not deserve to be refunded? Answer. On the contrary, I do understand that Canadians who have saved money for a long time for the purpose of buying their tickets, which are expensive, should be helped. So this is why we're working with airlines throughout the world, and we'll have news over the next few weeks. Thank you. On another topic, Mr. Trudeau. Mr. Sajjan, the Defense Minister, said that the current military contingents which has been sent to the long-term care homes is not their work is not sustainable. So what will happen in the future? Our seniors are going through a very difficult situation, and as I said, the federal government will be giving help and supporting the provinces so that they will get a good control of the situation, because the situation of our seniors is very important for us. However, asking the Canadian Armed Forces to work in those LTCH is, as of necessity, a short-term solution. So we want to make sure that we will have solutions which will be viable and sustainable as we look forward. And this is what we're discussing with the Quebec and Ontario Minister. And we will continue doing it.
Government ensure that we are there to support the provinces as they work to regain control over senior care in their jurisdictions. The situation going on in Quebec and Ontario is extremely worrisome, and we will be there to help. This is something that all Canadians want to see, and quite frankly, the women and men of our armed forces are there to protect Canadian lives and are happy to be doing it even at risk to themselves. That's what they do, and we should all be incredibly proud of them. At the same time, I have stressed from the beginning that soldiers in our nursing homes is not a long-term solution. It's a short-term fix. And we will continue to work with Quebec and with other provinces to ensure that they are able to regain control over senior care in their provinces. We will continue to be there with them to find solutions for the medium and longer term.
Thank you. Next question.
Merci. Question suivante.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir.
Next question, Hélène Buzetti, Le Devoir. Good morning, Mr. Trudeau. Earlier this week, we heard that it was not possible to extend isolation and confinement. Now we have old people who are dying from COVID, so maybe we have been invited to establish or adopt more discreet protection measures. What do you think of it? Answer. Well, first of all, we do listen to our public health experts who know exactly what we should be doing to protect all Canadians. Of course, our seniors are more vulnerable and they might die from COVID, and we've seen the sad results and the number of deaths throughout the population, but more particularly amongst the seniors. So we will continue to reopen our economy, to restart it in a gradual and responsible way, all the while complying with the scientific directives we receive and also protecting Canadians in general. And we need to have Canadians, if we want to restart the Canadian economy, they have to be in good health.
Oui, en fait, sur un autre sujet, vous avez parlé de
On
votre
another
appel
topic, you talked with the premiers, the sickness leave, and what has been the reaction? Because not all premiers seem to be in agreement with you. And also during the week you have offered some telephone operators for the purpose of managing those 23,000 calls a day. I'd like to know if the premiers took up your offer. Yes, several provinces did take up our offer to help for the purpose of improving the contact tracing activity. We know that screening and contact tracing will be essential if there is a second wave or even a local outbreak in the future. Regarding the sickness leave, we continued working on it yesterday again, and not all are in agreement, and not all of the same perspective on the issue. Some are concerned that we might be adding to the expenses from the private sector's companies, but I reassured them, and I told them that the government would be taking on board a large share of this support for people who do need sickness leave, because we know that at the fall, people will try and hide the fact that they're sneezing, for instance, because they will want to continue to work in order to support their families. This is not something advisable for the whole of our society, so we should avoid people having to choose between their health and work and a paycheck.
Prime Minister Julie Van Dusen, CBC. You mentioned, obviously, that soldiers they blew the whistle on the horrors that are going on in seniors' homes that a lot of families already know about, but they're not the long-term solution. Now, your letter here that you put out today after meeting with the premiers, you talk about agreeing to take action. I haven't heard any action. I mean, you can't go back on the soldiers because you say they're not the long-term solution. So can you be very specific? What is your action? Because people actually, when you say we're there to help, they actually want to know the details. Is it more money with strings attached? Is it national standards? I mean, what do those words mean?
We recognize fully that long-term care and senior care is a provincial area of jurisdiction. But all Canadians are united in wanting to see better support for our seniors right now and in the years to come. So we have said at the federal level that we will be there to support the provinces, both in the immediate, whether it's more rent money or more resources or whatever it is that the provinces need to get control once again over their long-term care facilities. There are a number of provinces across the country where, although there have been challenges, there are not nearly the scale of problems that we've seen in other places. So we recognize there is a great variance across the country, but as a federal government, our job is to look out for all Canadians and make sure that everywhere across the country people are supported, and we will be there depending on what the provinces need, what their situation is, to make sure that all seniors are protected. Okay.
We recognize that the long-term care homes are a provincial jurisdiction, but this is an issue of importance to all Canadians, and we ought to make sure that all Canadians are well protected throughout the country. So we'll be helping and supporting the provinces in their needs, the short-term needs and long-term needs. In the short run, we are now we are now being supported by our Canadian Armed Forces, and we are also giving help to the provinces so that they will regain control of the situation.
But I need to ask you about mortgages, because you must be aware that some families are having to break their mortgage contracts early. So would you consider telling the banks to ease mortgage penalties for those Canadians who are stuck in this position because they have no work.
We have seen banks take significant measures on helping Canadians who have difficulties with their mortgages, and we will continue to work with financial institutions right across the country to ensure that they are there to continue to help Canadians. We know that this is a very, very difficult time for many families. We've made available many income supports, but there is always more to do, and we're going to make sure that financial partners are part of the solution to making sure Canadians get through this.
We do know that in spite of all the assistance we've been providing to Canadians through the federal government, there are other challenges that Canadians must confront. And we are expecting banks to also do their share. They have already made a number of provisions for the purpose of helping people who are in difficulty with their mortgages, and I know that they will be willing to do more.
Question on the specific action. Okay, let's drill down. So the federal government was there to support provinces. What did Ontario, what do they need? What does Quebec need beyond soldiers? What does New Brunswick need? Can we hear some more specifics about what the federal government is going to do in individual cases?
The federal government will be there to support provinces and jurisdictions that need help managing their long-term care situations, whether it's Canadian Armed Forces in the short term, whether it's more resources or more money in the medium and longer term. We recognize this is a provincial area of jurisdiction that they are in control of, but we also know that having certain provinces lose control of the safety of their seniors means that we need to be there to support them as they regain control, and we will do that. But as you point out, there are a range of needs, a range of situations across the country, and one-size-fits-all from the federal government is not the best way through this.
No.
Okay. Nous allons être là pour aider les provinces.
We'll be here in order to help the provinces, in order for them to regain control of their jurisdictional responsibilities. For the time being, we are counting on our Canadian Armed Forces, but in the longer term, we'll be providing them with more resources, more money.
The support role to provinces, but there is lots of places for the federal government to lead, and you have your own members of parliament, your own caucus have written you a letter saying, let's have some national guidelines on this. What have you said to Jen O'Connell, Gary Anandasangari, Yvonne Baker? I'm probably missing one, but what's your response? Where's the national guidelines? When are they coming?
Our members of caucus, not just those, but all members of caucus across the country, are worried about the plight of our seniors in this situation right across the country. They are more vulnerable to COVID-19, and they all want to make sure that we are doing everything we can to support our seniors right across the country, and we are. There are, of course, going to be a need to have very real conversations, not just between order of governments, but as Canadians, about how we make sure that we are properly supporting the seniors who build this country with their hard work, the seniors who deserve a secure and dignified retirement. These are things that all Canadians want to see us do better as a country, as a society on, and we will be there for those conversations in the medium and long term. But right now, we're still dealing with this emergency of getting people the support they need faced with this COVID crisis.
Bonjour, M. Trudeau. Louis Blouin, Radio-Canada.
Louis Blouin, Radio-Canada. Yesterday, at the Prime Minister's meeting, there was a mention of reopening the border between Canada and the United States in order to allow family reunions. So is this really discussed at the moment?
We are looking at circumstances where Canadians or permanent residents have a spouse, children, or parents, so very close family relationships on the other side of the borders, on the other side of the Canada-U.S. border, and cannot join their families. We've seen many stories in the news in recent weeks with some very touching stories about divided families. So we're trying to see how we can bring some change to allow families who have been divided to come together. I've always promised, however, to provincial and territorial premiers that any issues relating to the Canada-US border and other issues affecting them would be discussed with them before any changes are made. So before loosening any of the rules, we need to set out the details and do this in agreement with the provinces. We are keeping the border closed as agreed until June 21st, but some small exceptions could perhaps be made. We've been talking about it with the provinces. Some provinces are open to it. Some have concerns. We will continue talking and ensure that we're doing the right thing while making sure that we continue to protect the health of Canadians as a priority.
Unprecedented measures at the U.S. border to prevent non-essential travel. We've continued with our supply chains and with essential travel and, of course, Canadians coming home who then need to quarantine for 2 weeks. But there have been a number of stories in the media over the past weeks and things we've heard directly from MPs on families who have close family members who are separated because of citizenship at the U.S. border. And we have been looking at ways of perhaps allowing close family members, children, spouses, or parents of Canadian citizens or permanent residents to be able to reunite under strict conditions through a slight modification of the directives for the Canadian Border Services Agency. This would not change the approach on closing the borders until the end of June, and depending on discussions beyond, but it is looking at can we support families that are going through extremely difficult times. However, the borders are an issue that deeply concern all the provinces. So I've made many commitments to them over the past weeks that we would always bring up any issues or concerns we had around changes at the border. And we had a good discussion on it last night. There are a number of premiers who feel that for reasons of compassion, we should and could move forward with this measure. There are others who expressed a certain amount of concern about it. We will continue to engage with them. We will continue to look into this matter and ensure that no matter what we do, we are keeping the safety of Canadians and well-being of Canadians at the forefront of any decision.
Juste pour préciser une chose là-dessus, à quelle échéance verriez-vous ça arriver selon
When would you see that happening? And with regard to paid sick leave, you said you would be ready to assume a large part of the responsibility. Does that mean you'd be ready to pay for all or most of the program? We are still talking about paid sick leave. I've said from the very start that the federal government understands
des coûts sur les entreprises ces jours-ci.
The costs that businesses have to deal with recently and the stresses on provincial coffers as well. Those discussions are continuing. As for the border, in the coming days or in or next week, this might be considered. But as you can see, talks on this are continuing.
Say that military members in long-term care facilities needs to be short-term, not long-term. But the Premier of Quebec is asking until September, so it's only a few months. Why can't the Canadian government commit to having the military assist long-term care homes in Quebec at least until that time? Is there something else those soldiers have to be stationed to or sent to? Is there a reason that that commitment to September can't be made?
These are operational discussions that are ongoing between Quebec, the Government of Quebec and the Government of Canada and the Canadian Armed Forces. We will continue to have those discussions. And as I said, we will continue to do everything we can to be there to support Quebec as it works to regain control over its long-term care institutions.
What discussions have you had with Ontario Premier Doug Ford? Of course, his government cut $34 million to long-term care funding, and now his province is asking the federal government for financial assistance. Where does that leave the federal government in helping provinces if they've already cut budgets to vital services for seniors and long-term care residents?
I think many of those questions are the medium and longer-term questions around what we need to do to ensure that our systems are properly able to support our seniors. But at the same time, right now, we are focused on helping in an emergency situation, helping seniors, helping Canadians get through a very difficult situation. We will continue to be there for them. We will continue to work closely with provinces and give federal support wherever necessary. I just want to make a quick point on what is happening in the United States. Many Canadians of diverse backgrounds are watching, like all Canadians are, the news out of the United States with shock and with horror. Anti-Black racism is real. It's in the United States, but it's also in Canada. And we know people are facing systemic discrimination, unconscious bias, and anti-Black racism every single day. We need, as a society, to stand together, stand up against discrimination, be there for each other in respect, but also understand that we have work to do as well in Canada, in our systems that we need to work forward on. And I call on all Canadians, whether it's anti-Black racism or anti-Asian racism or racism and discrimination of any type, to stand together in solidarity, to be there for each other, and know just how deeply people are being affected by what we see on the news these past few days. Je prends un moment pour souligner aux Canadiens qui
I'd like to take a moment to point out to Canadians who are watching with horror what's going on in the United States. To remind them that even though what's happening now may be happening in the U.S., there is racism and discrimination in Canada as well. And we need to do better, be it for anti-Black racism, anti-Asian racism, systemic discrimination. We have work to do here too, and every day we need to be sure that we stand in solidarity with respect and compassion for all our citizens. We need to understand the reality and the challenges that people face in difficult times. If we can understand that, we will come out of it a better country. We are seeing every day what people have to deal with during the pandemic and how Canadians can help one another.
Very best in your next chapters.
Oh, thank you.